Morgan Leeper, and this is my informative speech on Alzheimer's disease.
Hey.
It was a beautiful sunny day, and my grandfather was a little restless. He went outside to sit under the huge oak tree. Later that day, he decided to run some errands. He went back inside and told my grandmother that he was going to Walmart to pick up their medication. An hour went by, and my grandmother was a little nervous, but knowing he loved to talk, she wasn't too terribly concerned. However, when he had not returned, she notified our family. After an extended search, we found him safe, but terribly disoriented. He stated he was lost and could not remember his address or phone number to call. The one-time familiarly traveled roads that he had known all his life were eerily different than how he remembered. What is Alzheimer's disease? According to the Alzheimer's Association 2013, Alzheimer's disease is a type of dementia that causes problems with memory, thinking, and behavior. The Alzheimer's disease literally deteriorates the brain. In this picture, you can see the normal brain versus the Alzheimer's disease affected brain. Alzheimer's disease has 7 main stages that are drugged along with major symptoms and signs. Alzheimer's are still being researched, and the prevention and cure of this disease is still limited, with hope for improvement in the future. The stages of Alzheimer's disease are serious and should not be overlooked at any time, and the statistics will shock you. There are 7 different stages of Alzheimer's. These stages range from mild to severe functions. Working in a nursing home, I have experienced most all of these stages. Stage 1 Alzheimer's is very normal with little impairment. Very little is wrong with the individual's function of the body or memory. Stage 2 Alzheimer's does consist of individuals forgetting little words and certain location of objects. Most individuals in the nursing home would meet stage 2 Alzheimer's. A few of the residents are considered stage 3. Stage 3 would consist of having problems with names and having problems with the right words. They also have problems with relevant tasks. One resident at the nursing home is in stage 4. Stage 4 is forgetting recent events or history. For example, she would eat dinner and then she would keep asking, when's dinner time? When's dinner time? Like forgetting she just ate. But she does know certain names still. After stage 4 is completed, Alzheimer's begins to become very dangerous. Stage 5 patients have problems remembering their own address or where they even grew up. At this stage, the resident can feed themselves and can use the bathroom. Stage 6 is a very serious Alzheimer's stage. At this stage, the individual does not remember their name, cannot use the bathroom by themselves, cannot dress themselves, and they start to wander and get lost. It's a very scary disease with time taking over their bodies. The most critical stage is stage 7. In stage 7, the individual's swallowing is impaired and they have no support to hold their head up. These stages are very dangerous and should never be overlooked by anyone. There are 4 main factors that cause Alzheimer's disease. Age is a main factor. Any individual over the age of 65 has a possibility of retrieving Alzheimer's. Over the age of 85, the rate increases by 50%. This first chart explains how the adults aged 65 or older with Alzheimer's disease, and you can see with a female is 65.4% and the male is 34.6%, stating that more female have Alzheimer's disease than male. And the second chart is saying is how Alzheimer's increases with the increase of age, and this is 80 to 89-year-olds is 11 prevalence per 100 population. So the older you get, the more likely you are to develop this disease. Family history and genetics are linked to the disease. According to the Alzheimer's Association, the gene EE4 contains 20 to 25% of all Alzheimer's cases. Aside from family history, genetics, and age, there's many other factors that can contribute to Alzheimer's, such as head trauma from a fall or a wreck, or vascular dementia. There are medicine patches as well as pills to help cure this Alzheimer's disease, as there's not a known cure today. Also, the use of treatment and therapy will help individuals with this disease. Alzheimer's is an awful disease that is very serious. The symptoms and signs should not be overlooked at any time. According to the WebMD and the Alzheimer's Disease Health Center, there are many tips for maintaining a normal life. Tips mentioned with certain situations such as coping, planning, driving, communicating, and avoidance to getting lost. These tips will help along with the technology that's improving. Scientists are helping dramatically, and the disease will hopefully soon be conquered. And there will be hope for the future. If you have a family member or anyone you know who is coping with this awful disease, I strongly encourage you to read the articles online and learn how to make their lives